Good morning. Today is Tuesday, May 14th, and today's webinar will be on vaccine storage, handling, and transport. Today's webinar will be presented by Kelohi Corpus, who is one of our vaccine supply chain quality assurance assessors. Next slide. So regarding any questions, during today's webinar, please use the chat to ask your questions so the VFC program subject matter experts can respond directly. We will be answering all of your questions at the end of the presentation. Next slide. So just a few housekeeping items. For the QA team, please ensure you are muted throughout the presentation unless you are speaking, and please monitor the chat for any questions. For attendees, please enter all questions into the chat, and these will be answered at the end of the presentation. Today's session is also being recorded, and slides and webinar recordings will be uploaded to the link below, the health.vfc, or sorry, the health.hawaii.gov link. And to be added to the Hawaii VFC program email list, please email your request to hawaiivfc@doh.hawaii.gov. And in the subject line of the email, please write email list. Next slide. So today's objectives are, by the end of this presentation, attendees should know how to properly store and handle VFC vaccines, be familiar with the acceptable modes of VFC vaccine transport, and know how to ensure vaccines remain viable during planned and unplanned vaccine transport. Next slide. Okay, so now Kelohi will present the remaining slides for VFC vaccine storage and handling.
Okay, thanks, Jen. So we'll begin with storage and handling. Next slide, please. Proper storage and handling begins with an effective vaccine cold chain. A cold chain, by definition, is a temperature-controlled supply chain that includes all vaccine-related equipment and procedures. The vaccine cold chain begins with the cold storage unit at the manufacturing plant, extends to the transport and delivery of the vaccine, and then correct storage at the provider facility, and ends with the administration of the vaccine to the patient. Vaccine must be stored properly from the time they're manufactured to the time they're administered to the patient. If the cold chain is not properly maintained, vaccine potency may be lost, resulting in unusable vaccine supply. Potency is reduced every time a vaccine is exposed to an improper condition, and once lost, potency can't be restored. Results of a break in the cold chain can be costly not only to the provider, but to the patient and the overall public confidence in vaccines as well. An effective cold chain relies on three things: well-trained staff, reliable storage and temperature monitoring equipment, and accurate vaccine inventory management. VFC primary and backup coordinators should have adequate knowledge of the vaccine cold chain and should inform any other staff that handle or administer VFC vaccine of its importance. Next slide, please. The vaccine storage units. It's important that your facility has proper storage and monitoring equipment and that they are set up correctly, maintained appropriately, and repaired as needed. There are a few different types of vaccine storage units that the VFC providers are permitted to have. These include purpose-built or pharmaceutical-grade units, household or commercial units. This will be typically the units you find in your home. It could be combination units, but refrigerator section only is allowed for VFC vaccine storage use. You can also have standalone household units, so two separate units for your fridge and your freezer, but there is absolutely no dorm or bar style units that can be used to store VFC vaccine. The last type is doorless or vending style units. This is typically an AccuVax. Yes, next slide, please. Vaccine should be stored in their original packaging always. The vaccine and their corresponding diluent, if possible, are recommended to be positioned 2 to 3 inches from the unit walls, ceiling, floor, and door. It's also best to position the vaccine in rows to prevent overcrowding and to encourage proper airflow. The shelves and/or containers in the unit should be labeled to prevent inadvertent use of the wrong stock or the wrong vaccine. Diluent should never be stored in the freezer, and providers should avoid placing or storing any items other than the vaccine, the diluent, and water bottles if recommended by the unit manufacturer in the storage units. There shouldn't be any food or any other non-vaccine related items in the storage unit. Vaccines and diluents should be placed with the earliest expiration dates in front of those with later dates. Pictured here is an example diagram of the recommended setup of your vaccine storage unit. We do not recommend any vaccines stored on the floor, and that should actually be where your water bottles will be placed. Yes, next slide, please. A little bit more on vaccine storage units. So VFC providers who are currently using both sections of a household or commercial combination freezer refrigerator unit to store VFC vaccine will be required to purchase a standalone freezer unit after July 1st, 2024. You may continue to use the refrigerator section of the combination unit should you wish to do so. However, if freezer excursions are found in your freezer section of the combo unit prior to July 1st, 2024, a new standalone unit will need to be purchased as soon as possible. Unfortunately, vaccine ordering for frozen vaccines will be placed on hold until you're able to procure that unit. Any provider who are looking to purchase a new unit, we ask that the VFC providers alert the Hawaii Department of Health VFC Quality Assurance Team prior to purchasing to ensure that the new unit meets all the VFC program requirements. Once procured, we also ask that the providers allow the unit to stabilize first for a few days and then submit at least 5 days of stable within the appropriate range temperature data before moving or transferring any vaccine into the new unit. This is to prevent any kind of vaccine loss that may arise from any kind of temperature excursion that occurs in the unit during the stabilization period. Next slide. Every vaccine storage unit must have a temperature monitoring device, an accurate temperature history that reflects actual vaccine temps is critical for protecting your vaccine. The CDC recommends that the use of a specific type of TMD called digital data loggers, or DDL. DDLs provide the most accurate storage unit temperature information, including details on how long a unit has been operating outside the recommended temperature range. Unlike a simple min-max thermometer, which only shows the coldest and warmest temps reached in a unit, a DDL provides detailed info on all temperatures recorded at preset intervals. Most DDLs use a buffered temperature probe, which is the most accurate way to measure actual vaccine temps. For ultra-cold units, it's a different probe. An air probe is typically used, so that's a different DDL altogether. DDL data is required to be kept for at least 3 years, along with all other VFC-related documents. VFC providers are also required to have at least one backup DDL with a different calibration date in the event that vaccine needs to be transported, whether it be for planned or unplanned emergency transport, or if your primary DDL breaks or malfunctions. DDLs do have certain requirements in order to be acceptable for use by the VFC program, and it should have a detachable probe that best reflects vaccine temps, so that's going to be the buffered probe. It should have an alarm for any out of range temperatures. It should have a low battery indicator. It should have a visual display that displays current min and max temperatures. It should have the recommended uncertainty of plus or minus 0.5 degrees Celsius or plus or minus 1 degree Fahrenheit. It should also have a logging interval that can be programmed to record temperatures at least every 30 minutes, and it must also have an active certificate of calibration. Expired certificates of calibration are not accepted by the VFC program. Next slide, please. Wireless electronic continuous temperature monitoring systems are also an acceptable TMD as long as they meet all the necessary DDL requirements. Wireless or electronic TMD systems allow a clinic to monitor temperatures in real time on a remotely connected device. VFC providers who elect to use a wireless or electronic TMD are still required to ensure the system meets all the VFC temperature monitoring DDL requirements. They must perform all required temperature monitoring documentation and also submit those monthly temperature documents to the DOH email. Next slide, please. Monitoring vaccine storage equipment and temperatures are your daily responsibilities to ensure the viability of your vaccine supply and the safety of your patients. Implementing routine monitoring procedures can help you identify temperature excursions quickly and take immediate action to correct them, which will prevent vaccine loss and the potential need to revaccinate patients. Here you'll see the temperature ranges for each unit. The refrigerator should remain between 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. The freezer should be between negative 50 degrees Celsius to negative 15 degrees Celsius, with the corresponding negative 58 degrees Fahrenheit to positive 5 degrees Fahrenheit. For those VFC providers who have an ultra-cold unit, it should remain in the range of negative 90 to negative 60 degrees Celsius and a negative 130 to negative 76 degrees Fahrenheit. VFC providers are required to check the min, max, and current unit temperatures at least once each workday. They should routinely download and review the DDL data. Providers are also required to respond to any out-of-range temperatures found during the DDL review promptly and alert the Hawaii Department of Health VFC QA team of each excursion event. And providers are required to submit temperature logs monthly, regardless of whether or not you're going to be placing a vaccine order that month. Next slide, please. Temperature monitoring log should include min-max temperatures once per workday, should include the current temperature twice per workday, typically at the start and the end of each day. It should include the time, date, and the initial or name of the person who checked and recorded the temperature. These requirements are for those providers who use the typical digital data logger and also the wireless or electronic DDL monitors. Next slide. So I'm going to talk a little bit about power supply. Power disruption can result in destruction of entire vaccine supplies. Precautions should be taken to protect the storage unit's power supply at all times. VFC providers should plug in only one storage unit per electrical outlet to avoid creating a fire hazard or triggering a safety switch that turns the power off. They should use a safety lock plug or an outlet cover to prevent the unit from being unplugged accidentally. They should post do not plug signs on the outlet as well as on the circuit breaker. Providers should use caution when using power outlets that can be tripped or switched off, and should avoid using built-in circuit switches, outlets that can be activated by a wall switch, and any kind of multi-outlet power strips. Next slide, please. Responding to temperature excursions, any temperature reading outside the recommended range in the manufacturer's package insert is considered a temperature excursion. If an excursion, if a temperature excursion is found, VFC providers are required to respond promptly. The temperature excursion protocol is as follows. VFC providers should identify and notify any coordinators, managers of the temperature excursion. They should then download the data and evaluate the reasoning for the excursion, and then they should contact vaccine manufacturers individually. This is a new system we're trying to implement, is doing away with the stability calculators, as the stability calculators do not take into account previous excursions. So we're asking VFC providers to contact vaccine manufacturers by phone or by email to receive a case number and a corresponding representative name. And and notate that in the troubleshooting log. And then they should also contact the Hawaii Department of Health BFC QA team. Specific information regarding the temperature excursion protocol can be found in the temperature excursion tab in our toolkit found online, or you can find an informational webinar specifically on temperature excursions on the Hawaii Department of Health BFC website. Those are linked there on the screen. Next slide, please. Next, we'll move on to vaccine transport. Just some general transport requirements and reminders. The CDC does not recommend routine transport of vaccine, and it should only occur in the event of an emergency if possible. However, if transport does occur, vaccine should only be transported using appropriate packing materials that provide maximum protection to your vaccine. Different transport situations necessitate different methods for packing, and improper packing is as risky for vaccine as a failed storage unit. Emergency transport, such as a power outage or a unit malfunction, requires either a portable vaccine storage unit, qualified container and pack-out system, or the conditioned water bottle system. For planned transport, such as an off-site clinic, that would require either a portable vaccine storage unit or a qualified container and pack-out. The conditioned water bottle system cannot be used to transport vaccine during a planned transport ever. Next slide, please. Here are some transport methods, a little more on the types. So a portable vaccine storage unit is a powered refrigerator or freezer unit that's specifically designed to be used during vaccine transport. These are passive units that require a power source to function. There's also qualified container and pack out. This is the type of container and supplies specifically designed to use when packing vaccines to transport. They are also passive containers, but they do not require a power source and are considered qualified through laboratory testing under controlled conditions. And lastly is the conditioned water bottle transport method. Again, this method is the only method that can be used. This method can only be used during emergency transport. It cannot be used for planned transport, such as offsite clinics or a transport to a satellite facility. More information on the specific schematic for packing vaccine using this transport method can be found in our toolkit at the link below. Next slide, please. So materials for transport, BFC providers are always required to have materials for vaccine transport available in the event that an emergency occurs. Such materials may include a portable vaccine storage unit, qualified containers and packouts, phase change materials for vaccine-specific coolers, hard-sided insulated containers, or styrofoam. Frozen water bottles are also recommended to have on hand to be used in the conditioned water bottle transport system. Providers should also have a digital data logger to be used during transport, and also insulating materials such as bubble wrap and cardboard. Providers are also asked to utilize a transport log during transport to monitor temperatures, and that should be submitted to the Hawaii Department of Health BFC email. The use of dry ice or the coolant packs from the shipments or soft-sided food or beverage coolers are not permitted to be used during vaccine transport. The vaccine are at risk of freezing if the coolant packs or dry ice are used for transporting. Next slide, please. So packing and monitoring vaccine during transport. Providers should follow the manufacturer's guidance when using a portable unit or a qualified container and pack out designed for vaccine transport. This can include a conditioning process specifically for the qualified container and pack out system. Providers should not use the frozen gel packs or the coolant packs from original vaccine shipments to pack up refrigerated vaccine. As I mentioned before, they can still freeze the vaccine even if they seem conditioned or they appear to be sweating. Just a reminder, providers should never freeze your diluents, even during transport. Specifically for transporting open multi-dose vials, a partially used vial cannot be transferred from one provider to another. If necessary, a partially used vial may be appropriately transported to or from an offsite satellite facility operated by the same provider. So in other words, a provider cannot send or transport an open multi-dose vial to another facility altogether to be used. It can only be used during an offsite clinic or a satellite facility by which the original provider is hosting. Next slide, please. Just a little bit more on packing and monitoring. A calibrated DDL should be placed with the vaccine during transport. Providers and coordinators should monitor and document temperatures during the transport via the transport log. The time and temperatures at the start, during, and the end of transport are required. And if the transport is longer than an hour, for example, for an offsite clinic, those temperatures should be documented hourly. If an excursion occurs during transport or at offsite clinics, do not use the vaccine until the viability information is obtained and the Hawaii Department of Health VFC team has provided guidance. Next slide, please. Specifically for transporting frozen vaccine, it's a little bit different. CDC and Merck do not recommend transporting varicella-containing vaccines at all. If these must be transported in an emergency, it's best practice to use a portable freezer. For our providers here on Oahu, you may contact our team to potentially receive a loaner portable freezer if it is available at the time. A portable vaccine freezer or qualified container should be used, and they should maintain temperatures between -50 to -15 degrees Celsius. Again, you should not use dry ice even for temporary storage or emergency transport of frozen vaccine. Providers should be sure to unpack and store vaccine immediately in the backup location freezer upon arrival. Next slide. So that'll actually conclude our webinar here on vaccine storage, handling, and transport. If you do have any questions regarding HIR or registry, you can go ahead and contact them at the numbers listed there or shoot them an email. For any kind of immunization clinical consultation, you can contact the Hawaii Immunization Branch at the number listed there. Or for any kind of VFC related questions or concerns, please feel free to contact any member of our QA team. All of our numbers listed here, specifically for vaccine orders, you can contact any one of those staff members there, or our team numbers and emails are listed as well. Next slide. We ask that you please complete the following satisfaction survey. This will help us determine what other topics we'll go over, whether or not the times for the webinars are working for everyone, and we thank you for joining us.